afternoon. Today I'm going to discuss the reason why Good Samaritan Regional Medical Center in Corvallis, Oregon should consider the implementation of TeamSTEPPS, which is team strategies and tools to enhance performance and patient safety. The Agency for Healthcare Research and Quality, AHRQ, developed this program along with the Department of Defense as a teamwork system that offers a powerful solution to improving collaboration and communication within an institution, in this case Good SAM. Through the use of a strategic plan, it will be clear that the goal of adequate nurse-physician communication is essential. According to the AHRQ, hospitals that have implemented TeamSTEPPS have noticed a significant reduction in medication and treatment errors on patients. This will not only increase patient satisfaction, but decrease errors and potential lawsuits, therefore saving the facility money. The Women's Center is a part of Good SAM, and they care for a variety of patients: labor and delivery, recovery, postpartum, special care nursery, women's surgeries, and pediatrics. Due to this, the nurses work with several different physicians, and communication between them is important, and it is important for all of the players to speak the same language, and TeamSTEPPS will do just that. A SWOT analysis was completed that showed many strengths on this unit, including being the largest birth center in the system, offering current evidence-based practice in their care, and options such as water births, nitrous oxide, and vaginal births after C-section. Weaknesses that were found were lack of communication between nurses and providers, which was reflected on the patient surveys and nurse surveys. Even though TeamSTEPPS can make quite a dent in the budget initially, it will pay off in the end with better nurse-physician communication, which ends up in safer patient care, positive patient and staff satisfaction. It is important for stakeholders at Good SAM to be involved and believe in TeamSTEPPS. Stakeholders are management, staff, patients, family visitors, CEOs, COOs, presidents, board of directors, community, future patients. So me, you, and everybody else. A strategy map is necessary to explain the way that TeamSTEPPS will enhance and establish a culture of safety within Good SAM. The implementation of TeamSTEPPS starts with the training of master trainers who will then train everybody, including ancillary staff all the way up to physicians and the president of the company. Throughout the training, the vision will be cast and spread amongst the staff, and the entire hospital will be aware that the Women's Center is training because everyone else will go live later. Professional development and the master trainers will be responsible for educating all staff and new hires, in addition to maintaining records of who attended the trainings. The goals that we will be measuring come from the patient satisfaction surveys of did your nurse and physician communicate well? Did you feel that your plan of care was well communicated? Was the discharge process timely? During your hospital stay, did the nurses discuss medication side effects with you? Since patient satisfaction is tied to reimbursement that hospitals get through the CMS, TeamSTEPPS implementation will be huge. Also, staff will feel more confident to speak freely, yet respectively, and be heard. There will be no tolerance for disruptive behavior. Therefore, staff will feel they are in a safe place, and the culture overall will be safe. This will help reduce our employee turnover and decrease costs for training new employees. Next, an action plan is necessary to assist in completing this plan. Management must start this plan for implementation by creating a change team that is composed of leaders and staff that have authority, credibility, expertise, and motivation to make TeamSTEPPS successful. Management and the change team will identify an opportunity for improvement through reviewing the patient satisfaction surveys, work performance of staff, safety on the unit, and discussing with the frontline staff questions about the breakdown of critical information. The team will also identify what they want to achieve with TeamSTEPPS, looking at the goals, where they started, where they want to be. Upper management stakeholders will all be trained as well. Master trainers will be motivators and leaders on the unit and help train staff, like I mentioned before, and more importantly, lead the way through practicing what they preach by using this method. It is important to remain transparent during this implementation with both positive and negatives, and sharing this information with the staff and stakeholders. The positive vision needs to be shared so everyone understands the end goal, and this type of leadership strategy energizes the staff and motivates them to not be toxic in this new environment. There will be a rewards-based system for staff based on positive comments received from patients, other staff, and visitors. Each time a staff member is noted to be using TeamSTEPPS, their name will go into a basket for weekly drawing of gift certificates. This promotes the staff working towards something of importance. In addition to this, through monitoring of the patient satisfaction surveys each quarter, we will also, when we're in the green, which is a good area, have a pizza party or ice cream social for the department. Change is difficult for everybody. However, with a clear plan of communication of the vision of TeamSTEPPS, it will foster an understanding and buy-in from all. Creating a communication plan that targets the major stakeholders that will generate initial and ongoing support of TeamSTEPPS is important. This implementation will be communicated initially through staff meetings and provider section meetings. A brief overview of TeamSTEPPS will be given in addition to encouragement of staff and providers to become trainers. Continued communication to staff and providers will occur in weekly huddles and staff meetings, and they will be made aware of training dates and times through emails and posters from professional development. Staff will be signed up for formal training in November and December for the go live in January. A quality improvement board will show everyone on the unit on a monthly basis how we're doing. It'll be visible in the hallway to everybody. In addition, there'll be monthly TeamSTEPPS reports emailed out, and also we will review them quarterly at staff meetings. Providing a clear vision to staff and providers of why TeamSTEPPS is important and needed at Good Sam is essential when communicating this plan. Through the use of Cotter's 8-step change model, it will be implemented without much resistance. Cotter's change model includes creating a sense of urgency for the change, building a guiding team, creating a vision, communicating the vision, removing resistors to change, creating short-term wins, building on the change, and that the change should be part of the core of the organization. The leadership team needs to be able to understand, support, explain, and commit to using TeamSTEPPS. This will show the staff that it's important and encourage buy-in to this plan. If there are resistors to the change, it is even more important to communicate with them to help them understand why this change is crucial. Feedback and positive reinforcement are critical to success. Daily brief positive statements in front of staff, such as "Great SBAR" to Dr. Zane Melissa, will encourage others to do the same. The feeling of positive feedback feels good to people, and it is important to keep them on track towards the common goal. It's necessary to collect and analyze data about the progress of the TeamSTEPPS implementation because we will want to know if this plan is changing the culture of safety through improving communication between nurses and physicians. The balanced scorecard method will work great for overall performance of the hospital itself. However, on a departmental level, the feedback control model will work best. This allows managers to meet strategic goals by monitoring and regulating the activities and using feedback to determine if the plan that is implemented is successful or not. It allows for adjustments to be made by taking corrective action on certain levels or to fix or provide reinforcement if the plan is working well. Good Sam will be able to evaluate the past 4 quarters of this data from their patient satisfaction surveys that are sent out through National Research Corporation. And looking at the past 4 quarters going forward, once TeamSTEPPS is implemented, we'll be able to see if patients perceive that the nurses and physician are communicating well. Other ways to identify is to interview staff, direct observation, staff provider surveys. And these interviews and surveys should be done prior to the initiation of TeamSTEPPS, and then at 1, 3, 6, 9, and 12 months post-implementation, and then yearly as needed, related to patient satisfaction scores or staff suggestion. Survey data would reflect improvements in staff perception of communication between nurses and physician and vice versa. That is the goal. I ensure that you encourage all of you leaders to show the importance of why TeamSTEPPS is important to our hospital. All of this will positively impact the hospital facility, showing an employee retention, less disruptive behavior, higher patient satisfaction scores, and establish a culture of safety within the facility that encompasses mutual respect, trust, and accountability.